Hi. Today, I'd like to share some very important instructions regarding care after your rotator cuff surgery. Understanding and following these simple instructions is critical to a good recovery. We hope this educational video will help you feel more confident and get you back to your usual activities without pain. Now, I'll pass it over to my colleague who will explain how to use your shoulder sling and give you some basic post-surgery instructions.
Hi. Today I'm going to share important post-surgery instructions as well as demonstrate some best practices in support of your rotator cuff surgery. First, wear the shoulder sling and the abduction pillow all the time except when changing clothes, doing therapy exercises, or showering. Second, it's easiest to wear button-up shirts. Put your operated arm into the shirt sleeve first to make it easier to put on and take off the sling. Third, keep the sling on even when you sleep. You might find it easier to sleep in a recliner or with lots of pillows to support your arm if you sleep in bed. Last, taking the sling on and off might be tricky at first. Now I'm going to introduce to you the different components of your sling. First is your sling pocket, where you rest your operated arm. Second is your shoulder strap, directly above it. In the back is your waist strap that will attach in the front. This is your abduction pillow that rests at your side. And finally, we have two straps that just help keep your arm more secure in your sling. The first several days following surgery, you may need assistance putting your arm in the sling. These steps will remain the same, however, when you are ready to do it on your own. The first step is hold your operated arm with your unoperated arm. You will slide your operated arm in the sling with the abduction pillow at your side. Next, you will take the shoulder strap, bring it around your shoulder, and clasp in front. Next, you will take the waist strap, bring it around your waist, and clasp it in front. Here are the steps you will follow if you're putting the sling on by yourself. First, rest the sling on a counter or table in front of you. Next, strap in your shoulder strap to the clasps. Next, you'll slide your arm into the sling and bring your shoulder strap over your head, your abduction pillow resting at your side. Then you will reach around for your waistband and snap in the front so your arm is at your side. Now I'd like to share some information regarding pain medication and management. Take the medicine exactly as your doctor told you. If you have questions about the medicine, contact your doctor's office or use MyChart. To manage your pain, ice your shoulder several times a day, especially after therapy exercises. Ice for 15 to 20 minutes at a time, and then take a break for at least an hour to prevent too much inflammation. Now I'll hand it back to my colleague to talk about taking care of your incisions and what to expect after surgery.
Thank you. Taking care of your incisions is very important after rotator cuff surgery because you will have a few small cuts. Bandages. Keep the bandages on for at least 72 hours after surgery. After that, you can change the bandages daily. You can shower after 72 hours, but avoid soaking your arm, scrubbing the incisions, or putting lotion or ointment on them. For the first 2 weeks, keep the incisions dry and don't irritate them. You might see small yellow strips on the incisions called steri strips. Don't remove them. They might fall off on their own after a week. After surgery, you might be in more pain than usual. This is normal, so take your pain medication as prescribed and use ice often. Here's what you can expect after surgery. Sling time. You'll need to wear the sling and abduction pillow for at least 6 weeks. Your surgeon might adjust this time depending on your specific surgery. Using your arm. You won't be able to move your arm actively on your own for 6 weeks. After that, your surgeon will let you start using your arm more with help from a physical therapist. Physical therapy. You'll start physical therapy about 2 weeks after surgery. The therapist will help with moving your shoulder, wrist, hand, and elbow. Therapy will be 2 times a week for about 3 to 4 months. The goal is to get full, pain-free movement and start strengthening your arm. It might take up to 6 months to fully regain your movement and strength, and up to a year to feel like you did before surgery. Now we'll show you some exercises you can do at home right after surgery and tell you what to avoid.
In the first 2 weeks after surgery and before starting physical therapy, you should do some simple exercises at home. We'll show you these exercises so you can do them confidently. These exercises shouldn't be very painful, but a little discomfort is normal. Pendulums. Stand and use your non-surgical arm to support yourself on a table or chair. Let your surgical arm dangle and move your body gently to make your arm swing forward and backwards. Do this 3 to 5 times a day for 10 times each time. Wrist circles. Move your wrist in circles, both clockwise and counterclockwise, to keep it moving well. Do 5 circles in each direction 3 to 5 times a day. Ball squeezes. Use a tennis ball or similar sized ball. Gently squeeze the ball with your arm resting in your sling. Squeeze the ball for 5 seconds. Do 20 squeezes 2 to 4 times each day. Scapular exercises. You can do exercises to strengthen your shoulder blades. These include scapular rolling and retracting, squeezing your shoulder blades straight back. Do each exercise 2 sets of 10 repetitions, 3 to 5 times a day. Now, let's show you what you should avoid during this initial post-operative stage to protect your shoulder repair. Your physician and physical therapist will inform you when you may begin to perform these movements again. Don't lift or carry heavy things or reach up with your operated arm. Don't push with your operated arm, like when getting up from bed or from a chair. Avoid pulling with your operated arm, such as opening doors or mowing the lawn. If you had additional surgery on your biceps, avoid bending your elbow or letting it go past your waist. Don't drive while wearing the sling or while on pain medication for your safety and others. While rare, should you have any symptoms that include a fever, which is defined as 100.5 degrees Fahrenheit or greater, abnormal green or yellow discharge from the incisions, or red-like streaking from the incision itself, please contact your physician's office. If after hours, please call Riverside Nurse, a free service available to you 24 hours a day, 7 days a week at 1-757-595-6363 or toll free at 1-800-675-6368.
Thanks for watching and learning about rotator cuff surgery, recovery, and physical therapy at Riverside.
If you have more questions, please contact us using the information provided here.